So now Danielle has one of the most commonly requested no's.
I don't even feel like that's me, but here we are.
There are some other cultures that had rhinoplasty. In ancient Egypt, there's some pictures on hieroglyphics of people having what looks like some type of rhinoplasty. And there was
You have to break the nose.
Was my nose broken?
yeah,
You broke my nose?
I broke your nose.
Okay.
Sorry. Hi guys, it's Dr. Phil Solomon. I want to welcome you today to our second podcast of UnPhiltered. Today we're going to be talking to you about the topic of rhinoplasty. With me today, I have one of our famous staff, Nancy, who's been on some of the podcasts in the past and our Instagram. And we've invited one of our favorite patients who's been a patient of mine for almost 10 years, who underwent a rhinoplasty when she was just coming of age, 18 years of age. And now she's gone on to develop a successful career in real estate. And she's been nice enough to participate and share her experiences and how rhinoplasty impacted her life. So we're going to turn over the conversation to Nancy, who's going to ask some questions. And me and Danielle will have a candid, open, honest conversation about cosmetic surgery, specifically rhinoplasty.
Hi, everyone. So I thought we would start off by just giving you a little bit of background into rhinoplasty surgery. So Dr. Solomon, you can start off by telling us about the history of rhinoplasty. How far back does it go? Tell us about the trends over the years.
Sure. So rhinoplasty is an interesting operation. The history of it, there's actually been textbooks written on this topic. Modern rhinoplasty was invented by a surgeon named Jack Joseph, who was a German surgeon. He was actually an orthopedic surgeon, and he developed rhinoplasty approximately about 100 years ago. There are some other cultures that had rhinoplasty. In ancient Egypt, there's some pictures on hieroglyphics of people having what looks like some type of rhinoplasty, and there was even nasal reconstruction, usually for infectious diseases of the nose or trauma of the nose, where the forehead was used to reconstruct the nose. So rhinoplasty sort of goes back, almost predating modern plastic surgery. There has been an evolution of techniques as well as styles and shapes. There's been things that have been described as reconstructive in nature. There have been a trend towards very small noses, and then a trend towards conservative rhinoplasty called structural rhinoplasty. And now there's terminology called preservation rhinoplasty. A lot of these are sort of influenced by trends in pop culture, media, celebrities who may have nice noses, and certain aesthetic styles have changed as well over, generationally. So in my practice, typically we try to respect natural beauty, keep harmony, and keep things looking timeless, which is why bringing a patient in 10 years after the procedure and making sure that things have aged appropriately with the nose, from a teenage patient to a young adult patient, some of these things are really relevant.
So Danielle here is a perfect example of somebody who did it in their teens. Was it post-high school, during university when you decided to do yours?
It was first year university.
So what brought you in? What at that time of your life made you decide now's a good time?
So actually two of my good friends went to Dr. Solomon before I did, but they were in high school. I think they were around 16, 17. And I was feeling really insecure over the bump that I had on my nose. So I went for a consultation. I went for a few, and I really liked Dr. Solomon, and he gave me a perfect nose. So
Anyway, so we have your photos from just before the surgery. We'll share them. We keep all these archived in our charts. So
yeah.
This will just remind you. I mean, I'm sure you have your own photos, but the medical grade photography is sometimes interesting to look at. And the most profound change in Danielle's nose is really her profile. And
Here, Dr. Solomon, let's
I'll
share
let
it.
I'll let you look.
Here, do you want me to hold it?
Sure, yeah,
Oh,
you
yeah.
Sure, I don't.
How do you feel when you look at your
I
nose?
mean,
For everybody else.
I don't
if
even
you want to
feel
listen
like
to it.
that's me, but here we
It
are.
was you at this time of your life.
Yeah.
And this is now you at this time.
Yeah,
of
and
your
it honestly it changed my face. It's the middle of your face, so
life.
it definitely looks way better.
No, you look gorgeous, and
Yeah,
both versions of yourself are gorgeous. And when we post some of our before and after photos on our social media, it's interesting to read the comments. Probably like any other post or blog, you sort of see people weighing in with their own opinions. And sometimes we'll post a patient who has a dramatic improvement, and the patient's thrilled, and they've allowed us to share the results. And then we'll have most people, probably 80% of the comments will be super positive, saying, oh, she's so lucky, must be so happy. And then you'll have a few people weigh in and say, shouldn't have touched it, looked way better before. So it really is a subjective thing, and it's really not important. It's, feedback's always important, but it's really whether the patient feels happy with the outcome. And
I always feel bad when I see those comments, but they look better before it.
yeah, people's motivations to make a comment like that is sort of questionable, but some people may be sharing just their honest opinion and think that the person looked great before and didn't need to spend money and time to get cosmetic surgery. But there probably are some other factors as well.
Did Danielle have an open or closed rhinoplasty, and how do you make the decision? I mean, she loves her tip.
Yeah, I honestly don't even remember. I think it was closed rhino.
Yeah, so every surgeon's got their own approach. My personal approach is to utilize closed rhinoplasty when possible. That's an operation where everything is done internally. There's no violation of the structures of the tip, and there's no significant scar across the columella. So in patients that have relatively nice tips to start, a closed rhinoplasty is an amazing operation because it can make modifications to the profile and the nasal bones all internally. We can do some work on the tip as well through closed rhinoplasty, and more often than not, even if someone has a relatively nice tip, we do have to trim it a little bit just to make it match with the new bridge. Otherwise, the nose will look sort of like a nice bridge, and then it'll come out a little bit with some fullness in the cartilage. So we trim a little cartilage at the top, right where the tip meets the bridge, and then we create a new bridge, and then we often narrow the nasal bone. That's sort of a standard closed rhinoplasty, and that's what Danielle had. Open rhinoplasty is a different operation. I perform that operation as well, but I utilize it in cases where someone's got a very crooked nose, or in certain ethnic groups like Asian or African American noses, or in those cases, we're building up the nose, adding a lot of cartilage and restructuring it. So there's some advantages for the open approach in those circumstances. And revision rhinoplasty, sometimes I feel an open rhinoplasty is required to really look at what's underneath the skin, the structure that's been left behind from the previous surgery. So that's my own personal approach. And you may say, why don't all surgeons have that same approach? Some of it has to just do with their comfort level. As I mentioned earlier, rhinoplasty has been around like 100 years, and closed rhinoplasty was one of the more popular procedures in the 50s right up until the 80s. And open rhinoplasty started becoming much more popular in the 80s. It does have certain advantages in certain cases, but it became popular because it was much easier to demonstrate in courses and to teach residents how to do it. And so many of the younger surgeons, that's their go-to procedure. I was fortunate, I think, just when I trained that I was learning a little bit of both. So how I implement them is really case by case basis.
So people often ask, because I do, I read a lot of the inquiries that when patients contact the office, and people often ask, do you have to break the nose? Some people are, a little reserved about, they don't always want to have their nose broken.
Was my nose broken?
Yeah.
It was broke my nose?
I broke your nose.
Okay.
Sorry. So it's a controlled break, number one. It's using very small, delicate instruments called osteotomes, which are a little bit different in nature from a chisel, but it's sort of like a surgical chisel, but it cuts through bone. There are different instrumentation. There's some devices called piezo, and you'll hear terminology of sort of non-manual technologies that are utilized to cut bone as well, like saws and things like that. So moving the nasal bones in, and the reason we would do that in a case like Danielle's is when you reduce the bridge of the nose, you're now changing the shape of the nose, which has a pyramidal shape, and now you've flattened it with taking down the bump. So the profile may look really good, but front on, the person would have what's called an open roof deformity. Their nose
So that's like when you describe, just because for those who are not watching, who are listening, so it's like a triangle. When you take the top off a triangle, now you've got a flat surface, which will make it look wider.
That's right, exactly. And so when we're moving the bones in, we're actually trying to restore the triangle, but to a smaller triangle than we started with. There are certain rare circumstances where the nasal bones could be left as is, but they're usually in very conservative reductive procedures. And Danielle had a moderate reductive procedure, so the nasal bones needed to be moved in.
So now Danielle has one of the most commonly requested nose. We have her on our website. She's been on our social media. People always love Danielle's nose, partly because she's gorgeous and her nose is stunning. And Dr. Solomon did a phenomenal job on your nose.
Yeah, he did.
You get compliments on it all the time.
I still get messages, and it's been like 10 years.
It's been 10 years. So do you remember back in the day, do you remember meeting Dr. Solomon and deciding how he would be your surgeon and how you made that decision?
Let me look back,
That's a long time.
It's a long time. I don't even remember what I ate last week, but trying to think. I remember going to another surgeon first, and then I went to Dr. Solomon second, and I just felt comfortable with, what we discussed, and I told him what I wanted. I told him I wanted a very natural nose. I didn't want it like the tip to go up. And we went through like how the afters might look like. It's not a guarantee. Remember when you guys took photos of me? You guys took photos of like before and after. Yeah. And then we booked the surgery. Gave my deposit.
You just
and then,
Dr. Solomon.
yeah, I
You
trusted.
had a good instinct.
I trusted him, and then the day actually came and I was so nervous. But then it was fine. It wasn't even painful, and I didn't have any issues with my nose after 5 days. I went back to work. So, and then you guys took off the cast, and then I almost fainted because I was so happy. But yeah,
Oh, that's nice.
yeah.
So Danielle, how long would you say it took for you to see like the final result? Because we tell patients usually about a year.
Yeah.
We have patients sometimes takes a little bit longer. They saw more of a final result at a year and a half. For you,
think-
what was the experience?
Every year it looks better. The first 6 months, I know that it was kind of trying to like mold into the shape it was supposed to be because it was still kind of swollen. But I think it took about like a year.
Yeah, that's
a year
typical.
or two for it to be like, okay, that's the perfect nose. Yeah. But
Yeah, and it's interesting because the nose does change depending on the patient's skin type.
yeah.
The nose will change. Most doctors will say about a year, you'll sort of see your final results. So in our practice, we see everyone every few months for about a year, and then we sort of take photos and we check how it's doing. Some patients take longer than a year. Some people with a thicker skin or more complex anatomy may take longer than a year and change. One of my colleagues in Montreal was saying that he was photoing patients every year for 5 years and finding the nose change slightly up to 5 years. Now, change doesn't necessarily mean good because it could change in a bad way, right? So you're 10 years, you're good.
Yeah.
So now I don't think
You're
there's
safe.
any.
You're
need
safe
for
after
revision.
about a year, but we occasionally will see people who've had their surgery done and they'll come back 3 to 5 years later and they may say, look, it changed a little bit and now that I've developed some issues. So that goes back to the whole notion of conservative versus aggressive surgery. The more aggressive the procedure was done, especially the operations done in when I trained, like in the 1990s, 25 years ago, reductive procedures, which were a bit more aggressive and removing a lot of tissue to create really cutesy noses was sort of in fashion at that time. And a lot of those noses look good, but 5 years later, they may have had breathing issues, look kind of pinched or overdone. And you see that now, even in looking at some Hollywood celebrities where their noses are a bit overdone. It was sort of partly the technique that was used at that time.
So that makes me just bring up an issue because people often will say, well, it's the surgeon, right? They think it's the surgeon's fault my nose changed. They think it's the surgeon's fault that things happen with the nose that weren't maybe there at the initial healing process. And then a year and a half later, what did he do? He didn't do a good job. He didn't do something right. So we do see patients that come back and they kind of have that mindset, and people should know how much
especially
of it.
when we're seeing patients who've had surgery elsewhere coming for revisions with us. And part of our job is to be mature about it and counsel the patients like, look, this could happen to any surgeon, whether you think the surgeon did a good job or not. The truth of the matter is it has to do with your pre-existing anatomy, what they're starting with.
Anatomy is a big part of it that people have to understand, plays a huge role.
Yeah, the anatomy sets the stage, and then the surgeon does the best they can with their skills. And there are very varied skills like in every sort of line of work. And then there's the after surgery, how people heal. So there's sort of three factors. The surgery itself is one of the most important, but only one of the three factors. So preoperative anatomy, surgeon and surgical skill and technique utilized, and then after how you heal and things like that. So that's the reality of it, or the unfiltered truth of it.
So I thought it would be worthy of us to talk about turkey noses because we have a lot of people who bring us pictures of noses that they like, that they see done in Turkey. A lot of your competition might be going to Turkey. Some of the people who go to Turkey, they come back to us after Turkey and they say, oh, I don't really love my turkey nose, or I love my turkey nose, but it needs some steroids, or all of that. Am I allowed to say all that?
Yeah, it's fine.
Yeah,
whatever.
fine.
Yeah.
So anyway, let's talk about turkey. Well, just got to be careful
What are
because
my
like
thoughts?
a lot of the turkey noses are so beautiful. I mean, it's a common, I think that's a trend. we're talking about trends in rhinoplasty.
Yeah,
Turkey noses right now are a trend where people want that Barbie doll, cute, refined nose.
I think there's a bit of mythology like everything in the world. And I guess with Unfiltered, I'll try to dispel some of the mythology. So the truth is there's good surgeons, in Canada, and there's good surgeons in Turkey and the United States and all over the world. There's some not so great surgeons in different parts of jurisdictions of the world too. But I think there's been a huge amount of momentum on the marketing that's come out of Turkey. There's a big industry with aesthetic surgery where they're bringing in patients specifically for hair transplant and also for rhinoplasty to Turkey. Doesn't mean that they're better than the North American surgeons. Better is all, a funny word in aesthetic medicine. There's probably competent, good doctors there, and there's probably some good price competition. I think years ago, the pricing for similar procedures in that part of the world was substantially cheaper. So there was a big motivation. People could go there, get a first class experience, great hotel, good surgery, and it was substantially cheaper than in North America. Now, why would that be? I mean, in Canada, our prices are less than the United States. There's some economic factors, there's currency factors, and then there's medical malpractice insurance, which affects the pricing as well. The big risk of going abroad for a procedure is that if you don't like it, you have to go back to get a touch-up. We do find that it becomes a little complicated when patients are sort of stuck in Canada, not willing to go back and now wanting a revision and saying they just want a little tweak, because a tweak's not a tweak. When the patients had surgery by someone else and now they want us to take over their care, it's like we're starting from scratch. In fact, it'll probably cost them more at the end of the day because they now paid two surgeons rather than one. So that's really something to keep in mind. Is there a guarantee that a patient going to have surgery in Turkey is going to get exactly what they want? Absolutely not. I mean, we have patients coming all the time. We've had procedures all over the world, and some are very, very happy and want some minor adjustments, or seeing us because they ask us to take out sutures or inject cortisone in the tip because their surgeon in Turkey's asked them to do so. But we also see some patients that need revision surgery. They're not totally thrilled. Like the surgeons are only able to do so much. So in our own practice, if we operate on you and you need an adjustment, that's sort of part of the process. It's all outlined preoperatively. If you travel, you may need a touch-up as well. You have to be prepared for that. So that's more the factor. Now, in terms of the aesthetic, there's not some special aesthetic style that's only offered in Turkey or in Iran. Some of those procedures, to be honest with you, go back to the concept of stylized noses, which are a little bit more aggressive, which is kind of what I was doing 25 years ago on some of my patients. That's how I trained. And some of those noses can look really attractive on certain skin types. So Middle Eastern skin type, you could be almost a little bit more aggressive on the stylizing of the nose, but there are some potential pitfalls as well. You may end up over-operating. The nose can look a little bit overdone, and it may not look natural as you get a little bit older. So you may look really good at 18 to 25, and when you're 50, you may feel like your nose looks a little bit too cutesy for your relative to the rest of your facial features. You also potentially impact your breathing a little bit more the smaller you go. So those are kind of the variables. And so again, surgeons can do those types of procedures here. We may be a little bit more conservative in Canada in general and how we approach things. But I don't know if that answers your question about those are my general concept thoughts on Turkey in particular. Travel medicine, I think, is a broader thing. I mean, we see posts and things popping up on social media as well as in certain medical societies with warnings, don't go. I think in England they had a warning, don't go to Turkey, because they had a couple patients I think die. I don't know what, they may have been undergoing riskier procedures like Brazilian butt lifts in Turkey or in Mexico or in Brazil. And maybe the surgeons are expert, but things can happen because you're not just having surgery, you're having a general anesthetic, you're having nursing care. And remember, you're here, if something goes bad, you have sort of rights in North America. I mean, we have insurance, you have rights. There you have less ability to sort of resolve any issue. And God forbid something really bad goes down.
So advice is maybe better to do surgery close to home.
I think that's the general principle. I think we have patients travel to Toronto from as far as Vancouver, Victoria, and Newfoundland, but they're still within Canada. We do have some expats, a lot of expat Canadians who are living in New York City or Miami. We operated this week. We did facelifts on two gentlemen from Florida, and they came home because there's some financial savings due to the currency differential as well.
So let's talk thick skin, because if we're talking rhinoplasty, we do have to address thick skin because we do see a lot of patients who have thicker skin for rhinoplasty and they want smaller, cuter noses. And it's probably one of the most challenging things that you face in rhinoplasty, would you say, is thick skin, because people have a vision of what they want. And unfortunately, it makes it challenging to get it.
Yeah, so people don't understand that thick skin is one of the limitations of rhinoplasty. So what can we do for thick skin? So in general, the thicker the skin, the more structure the nose needs to almost overcome the thick skin. So it's almost like a tent. And I tell people it's like having a tent made of a sheet versus a duvet. If you have thick skin, it's the duvet. And even if you're having the sticks underneath, it'll always look like a duvet, kind of rounder. Whereas if you have thin skin on those sticks, it'll look quite triangulated like a tent. And so if you raise the pole of the tent a little bit higher, adding projection or adding more structure, that's all you can really do to try to create some of that definition that people are after. With that, you're actually making the nose bigger, a little bit more projected, which is the total opposite of what the patients are looking for. They're just wanting smaller and cuter. So you're actually slightly over projecting to create that illusion of thinness from the front on view.
So how would you describe Danielle's skin and her anatomy as far as surgery? So you can just explain
Well,
what
then, and not to butter her up or to blow
perfect
smoke,
anatomy.
but
Perfect
but she's a
anatomy.
very good candidate in
Yeah.
that she has like very nice skin.
Yeah.
Super thick skin's hard, but also super thin skin's
Yeah.
hard because it
Thin
also
skin,
shows
yeah,
it can
shows
show sort of
everything.
every sort of possible surgical imperfection that can occur. So medium thickness or medium to slightly thinner skin is what Danielle has. So you can sort of see all the nice elements. So she's got how the light sort of reflects off the tip. Those are nice things that we want to see when we're looking. The way the light hits her nasal bridge, it's going to send reflection back in a positive way. Whereas someone with thicker skin, it doesn't do the same sorts of highlights on the nose. That's why people with makeup are camouflaging the noses and drawing in and penciling in different ways that light hits the nose and reflects back to the eye. And people can play trickery, with certain things on their social media with apps and things like that. But makeup does the same kind of thing. So we see people, I want a nose like, and they'll say a celebrity.
Yeah.
And I'm like, well, I've actually seen pictures of that celebrity's nose without photoshopping and without makeup. And they actually probably have a similar nose to you
Yeah.
currently. So
Yeah. Social media definitely plays tricks on people. Thinking
Oh,
that
yeah.
they can get something that's really not as achievable or realistic.
yeah, and then the other super important point to make, just while we're on the discussion of like morphing and changing your images, is how people perceive themselves with the iPhones is very important because the lens on the iPhone is almost like a distorting lens. It's not like like what a photographer would use. So photographers, there's a whole science of photography and medical photography in particular, trying to capture it as is. And as you know, because a lot of the photos that are done in our office, it's tricky to do with the background, with the lighting, with the distance, which lens you use. So the iPhones even though it's very crisp and sharp, it can distort things. And so people sometimes are seeing themselves, differently from up
Angles,
here,
yeah.
here, and down here. And it's impacting the way they perceive their result from a rhinoplasty. They may can actually think their nose doesn't look great. And then we see them and
Oh,
take
yeah.
pictures, and we have to educate them and show them they actually
We see
look
people
really
coming in
good.
all the time with pictures with different angles, and we do our photography in the exact same spot with the same lighting, with the same camera. So we have a baseline for what is exactly going on. But when patients come in and they're not happy about something and they're holding up a camera and they're saying, "I don't like it. Look at, you can see like this." So yeah, it's a little challenging.
It can be a challenge for
Yeah.
sure.
All right, let's bring it back to you, Danielle. So it's been 10 years. Let's talk about how the rhinoplasty procedure changed your life. How do you think it affected your self-esteem? How do you think it affected the trajectory of your life?
Well, it changed everything for me because it changed the way my face looked because it's literally directly in the middle of my face. I always had issues with my side profile. It was a major insecurity. My nose is the only thing that I've really done on my face aside from like lip injections here and there. But it's definitely done wonders for me and made me feel a lot more confident. And confidence is important because in my business, I'm in real estate. So my face is everywhere.
As someone who works in the office and I get to be there before people are booking surgery or when I do their photos before surgery, and then I get to see them when their splint comes off, and then I get to see them again 6 weeks later when we take their photos, when, about 50 to 80% of the final result becomes present. It's super exciting and it's super fulfilling to see how people feel and how rewarding this procedure can be, because it really does change the way people feel about themselves, and it does change their self-confidence, and it's really a transformative procedure, and it's really amazing to see how people just are so happy after having the surgery by Dr. Solomon.
That's nice. Well, listen, this operation is definitely one of my favorite for that very reason. When we do it and when patients feel I made a big change in they show up in the office and they're sort of, you can just see the joy in their face, and then it gives you feel validated in your job, and that you feel like you're doing something good for someone.
There you have it, everyone. It's a wrap.